morning, everybody. I am Sanya from Prostate Wellbeing Team. I am sure all of you must be keeping good health. Today, we are going to discuss a very important topic that is benign prostate hyperplasia (BPH). Benign prostatic hyperplasia (BPH) is the non-cancerous enlargement of the prostate, usually being in the 50s in men, and which in many men may cause obstruction to urine flow. Many men have get to up and get to the toilet at night, and it is the most troublesome aspect of this condition, as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can be tiring for patients and can make traveling or attending events such as theater or cinema rather difficult. A doctor such as urologist can treat this condition and help the patient to get relief. To throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us a renowned urologist, Dr. Shriyansh Chahar, MBBS, M.Ch, MS Urology. He has rich experience and hands-on expertise in stool management as well as in treating urological problems. He is currently practicing at Dr. Shriyansh Urology and Kidney Clinic, Ajeet Nagar, Kheria Mod, Agra. Dr. Shriyansh Chahar has rich experience in the field of urology and carries out the diagnosis and treatment with utmost precision and efficiency, ensuring that patients' health is in safe hands. Doctor, we welcome you for discussing very important topic today.
Thank you very much.
And doctor, as we are going to discuss a topic called BPH, benign prostatic hyperplasia, my very first question to you is that what is basically BPH?
See, BPH means, if we expand the word, it means benign prostatic hyperplasia. So by the word itself, we can see it is a benign. Benign means anything which is not cancerous. Prostate and hyperplasia. Hyperplasia means increase in size of the prostate gland. So BPH is a increase in size of the prostate gland, which is not a cancer problem. It is only a benign problem. The prostate gland is present only in males. It is not present in females. And when the size of the prostate gland increases, it is called BPH, benign prostatic hyperplasia.
Okay, doctor. And doctor, what is the main reason, or we can say, what are the causes of benign prostatic hyperplasia?
See, as I have already told that prostate gland is only present in males, and we have seen that in almost everyone after the age of 50 years, this gland, the size of this gland tends to increase. It increases somewhat rapidly in some people and slowly in some people. The normal size is around 20-25 grams. So in some people after the age of 50, it will become 30 grams, some in become 50 grams, 60, 80. So the reasons are, it is a hormone dependent gland. It is a male hormone dependent gland. The male hormone is the testosterone, and the increase in size is mainly dependent on this male hormone. Other conditions like obesity, increase in size, is also associated with BPH. Hypertension, it is also associated with hypertension, BPH. And people who are not physically active, in those people also we can see the incidence of BPH is more. So there are various reasons, other medical comorbidities and hormone dependent conditions in which the size of the gland increases and it turns into BPH.
Okay, doctor. So these are the various causes of BPH, and as you said, that hormonal changes can be the one major cause.
Yes, right.
Okay, doctor. And doctor, when we are talking about BPH, what are some of the symptoms associated with BPH? How can one identify that these are the particular symptoms of BPH?
Yes. See, the prostate gland is situated around the urine tube in the males. That the urine tube is called urethra, through which we passes urine. So when the size of this gland increases, it compresses, it presses the urine tube. So it results in the urinary problems. The main symptoms of BPH are the urinary problems. And these urinary problems are like the person has to go and pass urine again and again during daytime also, and during night time also he has to get up and pass the urine again and again. There is problem in controlling the urine. There is some urgency to pass the urine. As soon as there is a feeling that I have to pass urine, the person is not able to hold the urine for a long time, and many a times the urine may leak also. Another thing, when the urine tube is pressed, the flow of the urine is very slow. It is not as good as in the normal people. The patient says that I pass the urine very slowly, and also the urinary stream is also not continuous. It breaks in between. Sometimes it comes, sometimes it stops, then again it comes, then it stops. It's like stop start thing. Intermittent stream is there. Also, the person has to put some pressure to pass the urine. He has to strain, he has to put some abdominal pressure so that there is increase in flow of the urine. And many a times, once the person has completed his urine, he said that I feel that there is still, I have more urine left, there is incomplete emptying of the bladder. Other than these important symptoms, there may be some burning in the urine, some blood may pass in the urine. So these are the common symptoms of BPH.
Okay, okay, doctor. So these are the common symptoms which usually people can see, and I
Yes.
am very sure that you are expert in urology. Might people have come to you by taking over-the-counter medicines, that if they are having some these kind of symptoms, they go to medical shop and take over-the-counter medicines. How harmful are these over-the-counter medicines in case of BPH?
Yes, yes. In our area, it is a very common practice that when some person has some problems, they will go directly to a medical store and they will tell that I am having this problem. So medical store person is not a qualified doctor. He is only a chemist. So somehow they give them some medicines. Sometimes these medicines will give them temporary relief, but later on the problems will exaggerate. Like for example, some people will come that I had problem in passing urine. My urine was coming very slow and in less quantity. So I went to a medical store and they gave me a tablet. And after that, I passed lots of urine. But after that, I am not passing urine at all. It is completely stopped. So what happened? Most of the time in such situations, the medical store people will give them some diuretic tablet. Diuretic tablet like Lasix or something. These tablet, what they does is that they increase the quantity of the urine. So already the person is not passing urine properly, his flow is slow, and when they give such type of tablet, the quantity of urine production is already is increased, and whatever urine is increased, the person is not able to pass that urine, and all of a sudden the urine stops completely, and then these people come to us in a urine retention, urine block type of problem, and then we have to put urine tube catheter to relieve from them. So my advice is that whenever the person is having any urine related problem, go directly to a qualified urologist, tell them your problem, so that they can give you proper treatment instead of going here and there.
Right, definitely, doctor. And as doctor said, that if you are having any such kind of problem, please go to your urologist because they are experts and they know how to treat any kind of problem. Doctor, sometimes you might have come across some people who said that, one of my friend or relative suggested some of the treatment home remedies or some medicines, and we took that, and the condition is more worse now.
Yes, it happens very commonly. See, because to understand the treatment of a problem, we have to understand the disease first. Why this disease is happening and what is the problem inside. And people will come that I got this powder from somewhere, I got these tablets from somewhere. No doubt these tablets or powders may give some temporary relief in the pain or in the flow of the urine, but we don't know what these things are doing inside the body, what damage these things are doing. Temporary relief will be there for 1 or 2 days, and the patient will think that my disease is cured, but it is not like this. But after some time, this disease will come in a severe form, and when then they come to us, then it becomes a problem for us because the damage has already been done. So it is not advisable to self-medicate yourself in such situation, because doctor is available. He is qualified in this field. He has knowledge about the disease. He has knowledge about the treatment. So why not go to a specialized doctor, get proper treatment, and get cure of the disease instead of just getting only symptomatic relief.
Right, absolutely right, doctor. And as you said, that self-medication is not at all advisable. And if you are having any such kind of symptoms, please visit to your urologist, because, as doctor said, that self-medication is not good for long run, and it can do a lot of worsen to your condition as well. Doctor, as we have talked about the causes, the symptoms, and what is basically BPH, what are some of the troublesome symptoms if somebody is having BPH? What are the most troublesome symptoms one may come across?
Yes, yes. The symptoms which I have already told you are, these are the common day-to-day symptoms which may bother the person, and he may go to the doctor. But if the person is not bothered about these symptoms, then there may be complications of these symptoms. The complications may be that all of a sudden the urine may stop. He may have pain in the abdomen. He feels that I have to pass urine, but he is not able to pass urine. This is called urinary retention. Then another thing is that he may pass lots of blood in his urine, so that is called hematuria. That is another complication of BPH. If these things are ignored for a long time, then he may develop stones in his urinary bladder. So the urinary bladder stone is another complication of urinary bladder is another complication of BPH. Then, for long time, if the person is not able to pass urine properly, then the urine will be stored in the urinary system. This will lead to recurrent urinary tract infections. Again and again, the urinary infections will be there. Burning will be there, fever will be there, pain will be there. Another and one more important thing is, if the urine is not emptying fully, it will be stored in the bladder, and because of the back pressure changes, there will be swelling in the kidneys, and the kidney function may worsen. So these are the some important and complications of BPH, like recurrent urinary infections, urinary stones, kidney failure, blood in the urine, and urinary retention.
Okay, okay, doctor. And that means if somebody is having any kind of symptoms, they should go to a doctor, so that
Definitely.
these symptoms cannot hurt them, because people usually don't go to doctor; they just treat themselves. And as we have discussed about the self
Yes,
medication as
yes,
well.
yes. Yes, this is definitely.
Yes, definitely, doctor. And when we have talked about the causes, the symptoms, and what is BPH, what are the various treatments options which are available for BPH?
See, there are there are different types of treatment. There are the treatment for BPH can be medical management, or it can be a surgical management. Depending upon the symptoms of the patient, we decide what treatment we have to give to that person. If the symptoms are very less and it is not bothering the person in his day to day life, then initially the symptoms can be managed with lifestyle modifications only. Lifestyle modifications in terms of weight reduction if the person is obese, blood sugar control if person is diabetic, blood pressure control if the person is hypertensive, physical increase in physical activities. Manage your fluid intakes, like avoid tea, coffee, soft drinks, alcohol too much. Try not to drink liquids 2 hours before going to sleep, so that there is not much of urine passing in the night time. Also, there are certain medications which which the person is already taking, and we can stop these medications, and the symptoms are cured. So there are certain lifestyle modifications which can help the person if the symptoms are very less in severity. Then comes the next step. When the symptoms are there, which are bothersome, the person is problematic in his day-to-day life, his urinary symptoms are problematic, then we start certain medicines depending upon the size of his prostate and other features. there are certain medicines available like alpha blockers. These are the various types of alpha blockers are there, like alfuzosin, tamsulosin, and silodosin. These are the class of drugs of alpha blockers, which relaxes the urinary passage and makes the urine flow proper. Then there are uh, five alpha reductase inhibitors are there, like finasteride and dutasteride. So we can use these combinations one by one or in combinations. If the person is happy with these medicines, some persons take these medicines for lifelong and they are very happy with the symptomatic relief. So we can continue these medications without much side effects of these medications. But suppose these medicines, we are giving certain medicines and the person is not very happy with the symptoms, and he or he does not want to take the medicines for long term, or there are complications which I have already told, complications like urinary retention, recurrent stones, recurrent infection, hematuria. If these things are there, then we have to go for the surgery of the prostate.
Okay, that means there are various treatments options which are available for BPH.
Yes,
So
yes.
if somebody is having BPH, it can be treated.
Yes, yes, definitely it is a curable disease. If timely the person goes to the urologist, the definite cure is there.
Okay, and as doctor said that it is definitely curable, and so if you are having any kind of symptoms, do visit your urologist. Doctor, as we are live, so we have some live viewers question as
Yes,
well who are
yes,
watching this live.
yes, yes.
There is Rahul who is asking, how does BPH affect urinary function?
See, BPH affects urinary function. Initially, what happens because of BPH, the urinary flow is less. The urinary flow is less. It takes long time for a person to pass the urine, and most of the time the urine is not completely empty. Some of the urine or most of the urine is left behind in the urinary bladder, which is not a good thing, because urinary bladder should be completely emptied. But in BPH, the urinary bladder is not completely emptied. Some of the urine is left behind in the urinary bladder. As the time progresses, this quantity increases, and this gives back pressure on the kidneys. So the kidney function may worsen. Another thing is that initially the person applies pressure, abdominal pressure, because of which some urinary flow will increase. But with time, the muscles of the urinary bladder will get fatigued. They will not compress. They will not function properly, and even after some time, they will fail to compress. So this term is called bladder decompensation. That even after giving pressure, there is no good flow. So if this thing is ignored, the urinary function will definitely worsen, and at a time will come when the urinary bladder will not empty even after complete putting complete pressure on this.
Okay, okay, doctor. And doctor, um, are people also ignorant about BPH, and are also they ignore the symptoms of BPH and don't go to urologist?
Yes,
Have
yes,
you
yes.
seen that this is very common?
Yes, yes, it happens very commonly. See, the BPH is a disease of the elderly. Elderly means mostly after 50 years, mostly after 60 to 70 years. When people come to us with for some other complaint, and when we ask them about their urinary problems, they say that urine is there, but the flow is less, and they get up many 4, 5, 6 times in the night. So when I tell them that this is not normal, they say we think that because of age, this is a normal phenomenon. That with now we are 60 or 70, so low flow is a normal thing. Getting up 4, 5, 6 times in the night is a normal thing, but it is not a normal thing. Even with increasing age, this has to be taken care of. So people are not much aware. They think that these things are normal for their increasing age. So it is not true. This is a problematic thing. These are the symptoms of BPH. We have to take care of them.
Yes, definitely, doctor. And as you discuss about age, there's a question from our viewer coming that what role does age play in the development of BPH?
See, most of the time, as I have already told you, it is a hormone dependent organ and a hormone dependent disease. Most of the time, the size of the prostate tends to increase after the age of 50. So when I say most of the time it is after 50, it does not mean that it will not happen before 50. In some very few people, it may happen at the age of 48, 45 also. But most of the time we see these patients at the age of 60 to 70 years. With age, the size of the prostate increases, and as the size increases, there are urinary problems. In some patients, the size of the prostate will become 50 grams, 60 grams, 70 grams, and they will start having all these problems. So age is an important factor per se for development of BPH.
Okay, so age is an important factor, and as you have already told us that after 50, usually people see the
Yes, yes,
symptoms of BPH.
yes.
Right, right, doctor. Doctor, there's a very important question coming up that is BPH is a type of cancer?
No, no, no. It is BPH. See, the name itself is telling benign. Benign. There, in medical terms, there are when we talk about cancer, there are two terms which we use. One term is the benign, and another term is the malignant. Malignant means cancer. Benign means non-cancer. So the BPH itself is not a cancerous disease. There is nothing to worry about. To check about whether this is a cancer or not, we have certain to check whether it is a cancer of prostate or not. We have certain other tests like the serum PSA and other tests by which we can say it is a cancerous prostate. But BPH itself is not a cancer disease.
Okay, so BPH is not a cancerous disease, and as the doctor already told that it can be treated, and there are more tests which are available for BPH. So BPH is not a cancerous disease. Am I right, doctor?
Yes, yes, you are right.
Okay, and doctor, there is a question coming from Deepak. Can medication worsen BPH symptoms?
Yeah, see, BPS, there are certain medications like medicines for cough, cold, and there are certain medicines which can worsen the BPS symptoms. Definitely, there are medicines like if you take any over-the-counter medicine for cough or something, and you already have BPH symptoms, urinary symptoms, then these problems can worsen.
Okay,
So if you
and
are,
doctor, as
so
we
if
have
you so if you
yes,
are taking if you are taking any medications and you have urinary symptoms, please consult your doctor that I am having urinary problems. I'm taking all these medicines. So is it safe for me to take these medicines or should I change them?
okay, so it's better to tell your condition to the concerned doctor
Yes,
that
yes,
these are the problems somebody is
yes,
having, and can we take the medications?
yes, yes,
Okay,
yes.
okay, doctor. Doctor, there is, as we have discussed about the natural remedies and home remedies as well, but there is a viewer asking that are there any natural remedies for managing BPH symptoms?
See, I won't say there are natural remedies like some powder or some herb or some tablet, something like this. But as I have already told, in the initial stages of the urinary symptoms, these can be managed by your lifestyle modifications. Lifestyle modifications which you can do. You stop taking alcohol, tea, coffee. Try not to drink water when you are going to sleep, and then try to reduce your weight, try to increase your physical activity, do some physical activities, yoga and something like that. So these are the remedies that you can do without taking any alternative medicines, the effects of which we don't know. So these are the lifestyle modification which we can easily do in the initial stages and get symptomatic relief.
Okay, okay, doctor. And as you have told us about the lifestyle changes, so are if somebody is having a good lifestyle, a physical activity and taking proper diet, can it help in reducing the symptoms of BPH?
Yes, yes, I have said that it depends on the severity of the symptoms, how severe the symptoms are, how bothersome the symptoms are. If the symptoms are there, but the person is okay that these symptoms are not hampering my day-to-day life, then in so we mean that the symptoms are in their initial stages. So in these stages, these lifestyle modifications are very helpful. Without even taking medicines for the BPH, if we modify our food intake, liquid intake, physical activity, sleep habits, And voiding habits, one important thing is that if we try to do double voiding means once we have passed the urine, wait for some 30-40 seconds there itself and pass urine again, so that the urinary bladder is completely empty. And also voiding means pass the urine every 4 to 6 hours at a scheduled time. So these are the very good lifestyle behaviors which can help the person in symptomatic relief.
Okay, so a good lifestyle can definitely help in reducing the BPH symptoms as well.
Yes,
Doctor,
yes.
if somebody is taking more intake of water, as told that taking more and more water is good for the system of the body system, is it preferable that if somebody is having BPH symptoms should take more water?
See, when we talk about the water intake in BPH patients, we say that the liquid intake in a 24 hours should be around 2.5 liters. This is what we advise to the patient. And in these things, in these 2 to 2.5 liters, we should avoid intake of tea, excessive coffee, excessive carbonated drinks, and excessive alcohol. These liquids we should avoid. Plain liquids, non-carbonated drinks, liquid water, milk, we can take in the quantities of 2 to 2.5 liters in a 24 hours duration.
Okay, so these are some of the things which someone should definitely take if they are having any kind of symptom. Doctor, any dietary precautions if somebody is having BPH or the symptoms of BPH? What should one should eat? Any dietary precautions?
Yeah, well, in the diet, two things comes. One is the liquid, and another is the solid food. The liquids I have already told you. In the solid food, we should take more of vegetables, fruits, and we should avoid spices. We should avoid fatty food like ghee, oil, and deep fried things. We should avoid these things. We should take more of vegetables in our food. We should take more of fruits in our food. We should take more of fibers in our food. One important thing which I would like to tell here is that urinary symptoms, these symptoms are worsened if the person is also having constipation. If the person is having constipations, then the BPH urinary symptoms will worsen. So to manage the constipation, one should take lots of fibers with along with the liquids, so that the motions are smooth and there is no constipation, and the adverse effect of constipation is not there on the urinary symptoms. So the diet should be more of vegetables, fruits, and less of oil, spices.
Okay, okay, doctor. So fiber intake is more, and as you have suggested, the liquid diet that these are the liquid which somebody should
Yes.
take, and fiber intake should be more because as
Yes.
if both the conditions are there, it can be worsen the BPH
Yes.
patient.
Right.
Okay, okay, doctor. And doctor, when we are talking about the diet, the precautions, and we have discussed about the age as well, is it possible that somebody who is less than 50 can also have the symptoms of BPH?
Yes, yes, it is possible. It is very much possible that people in the age of 45 to 48 or 46, they may have urinary symptoms because of BPH. So these people are also treated in the same manner like any other BPH patient. These patients are also treated in the same way.
Okay, okay, doctor. And doctor, there is also some kind of fear that if somebody is having BPH, as we have discussed, that it is a non-cancerous disease. But people panic very easily that if somebody is having such kind of symptoms because their life was good and suddenly they are facing such kind of symptoms, what advice you would like to give to the people who have, like coming in these kind of symptoms, who are seeing these kind of symptoms? What advice you would like to give to those people?
There is no need to get panic when you are having such symptoms. There is no need to worry about the possibility that because I am having these symptoms, so I will be having the cancer of prostate or something which is not curable. But when I'm saying that there is no need to worry, I'm also saying that there is no need to ignore also all these symptoms. Don't ignore. Go to your doctor, consult them. They will ask you certain questions. They will do certain tests. then they will decide which treatment is best for you. And the BPH problem, as I have already told you, if given proper treatment at proper time, is completely curable. And the panic about that it is a cancer, it will form cancer, is not worth. Your doctor will definitely investigate you by certain blood tests, by certain imaging tests, whether it is a cancer or non-cancer. And if it found that it is not a cancer, then there is nothing to worry about. Just go to your urologist, follow their advice, take the treatment properly, and definitely 100% cure will be there.
Yes, so there is no need to panic. If you are having any such kind of symptoms, you can go to your nearby urologist, because, as doctor said, it is a curable disease. It is non-cancerous. Doctor, as we mentioned that, sometimes if the patient who is having BPH, it can be tiring for them. Traveling may be a major cause that if somebody is having BPH, because there is a certain urge to urinate. So a social anxiety comes in the patient. What advice you would like to give to those people? Because due to that also some psychological problems can also occur.
Yeah, there are many patients in which the BPH symptom is that they have to pass urine again and again. There is urgency to pass urine when they cannot hold their urine for long durations. So these people become anxious that how will they travel for long distances, how will they go in social gatherings and all these things. Because of their urinary symptoms, they will face problems. So my advice to these people is that whenever you are having such problems, first thing is to consult a doctor. Your doctor will start a treatment. This treatment will definitely give you relief in all these problems. All increased frequency, your urgency will reduce. Another thing is that you have to check your fluid intake and all those things. Like when you know that you have to travel for a long duration, try to cut short your liquid intakes. Don't drink too much of coffees or tea outside, because all these things are diuretic. They will increase the urine production, and the urge of the urine will be there. So whenever such a situation is there, when you are traveling or something, try to cut short on your liquid intakes. Whenever you are going on a journey, try to empty your bladder, pass urine completely before the journey is started. And whenever there is a break in the journey, go and find a proper washroom and pass your urine there. Similarly, in the social gathering, also be aware of the nearby washroom. Where is the nearby washroom is there? Also, when you manage your fluid intake and when you are aware of your surroundings, where is the nearby washroom is there? Then I don't think that there is much to worry about.
Okay, that means proper taking care of yourself and knowing that these are the symptoms of
Yes.
BPH and I am BPH. So, these things should be taken care.
Yes.
Taking proper, less liquid and traveling. Am I right, doctor?
Right, right, right.
And doctor, as you have mentioned that caffeine intake and alcohol intake are also very injurious for BPH, but sometimes people cannot resist having caffeine or alcohol. What advice you would like to give to those people? Because someone is having BPH, but they have a habit of drinking caffeine or alcohol. What advice you would like to give to those
Yes, yes,
people?
yes, yes. Many people will come to us, and when we ask them how much tea they will drink, they will say, "I have 4 to 5 teas in a drink, and sometimes 3 coffees also, and alcohol intake is very frequent." So the important thing is that the person has to decide whether he has to enjoy these things with the problematic symptoms, or whether his priority is to get relief of his urinary symptoms. So you have to set your priorities. If you have to get relief from your urinary symptoms, then definitely you have to cut short your tea and alcohol intake. It will not happen overnight. I know that people who are addicted to tea and coffee and all those things will not stop all these things. So to them I tell them, if you are taking 4 teas in if you are taking 4 teas in a day, then try to decrease one by one in 2 days and bring it down to at least minimum of one per day. So this is how tell them. I know if I tell them that stop it completely, they will never follow this. So my advice is to gradually decrease your intake of all those things, so that it will help you. And once the person feels that when I have stopped drinking tea, I have stopped drinking alcohol, and my symptoms are improved, then they are motivated by themselves.
Right. The changes they will see by their own only when they
Yes.
reduce the caffeine drinks. And as you have mentioned, tea. And in India, it is very important that people drink tea. It is, as you said, that it is hardly that people come to you and tell that we take 4 to 5
Yes, yes.
drinks of tea in a day. So as doctor mentioned that if you reduce the caffeine intake, so that will definitely help in curing BPH. Doctor,
Yes.
there is also a question coming that if somebody is having BPH, can they do physical activities as well?
Yes, yes, why not? BPH will not prevent you from doing physical activity. In fact, physical activities are advisable in the lifestyle modification treatment of the BPH. Every person, irrespective of BPH or not BPH, they should do physical activities.
Okay, so if somebody is having BPH, it is not like that that you should be sad about it and no, don't do any other activities, physical activities. You can it is
Yes, yes,
you can do physical activities, go out, and a normal routine should be carried out.
yes, yes, definitely. Very much normal routine should be there.
Okay, and as doctor said, it is a curable a problem. It is not like that that BPH is a cancerous disease. Doctor, before we end this live session, any advice you would like to give to all the viewers who are watching this live? And we have discussed about the symptoms, the treatment, the causes of BPH. Any advice you would like to give to all the viewers watching this live?
Yes, yes. See, this program was basically based on the BPH prostate wellness. So the my advice that we have already discussed about what BPH is, what are the urinary symptoms of the BPH. My advice is that if you feel that your urinary symptoms have changed over a period of time, that you are now going more frequently to urine, and that your urinary stream has slowed down over a period of time, and that you take more time in passing urine as compared to the previous time, then consult a urologist. Go ask them questions. They will ask you questions. You can ask them questions. Discuss about your problems to find a solution. They will diagnose your problem. If required, they will give you medications. These medications are very safe, not much side effects, and symptomatic relief is superb. Even if the satisfying surgeries. They give instantaneous relief from the next day itself. These are very safe surgeries. Medicines are also very safe. So just because you have to take medicines or have to undergo surgery, it is not wise to just bear the symptoms and go on along with them, because they will cause problems, they will cause complications, and then the treatment will get difficult. So in the initial stages itself, go consult your doctor and get your symptomatic relief and get cure from BPH.
Okay, so as doctor mentioned, do not fear to ask question if you are having any kind of problem. Ask question to your doctor. Discuss with your doctor because it is very important to ask question. Discuss your problem because when you discuss, they know it better. Doctor, we have discussed about the symptoms, the causes, the treatment, and you have also answered our live viewer question as well. Before we end this live, any takeaway message for all our viewers watching this live?
The takeaway message is you keep yourself healthy, keep yourself active. Just because your age is increasing, you are beyond 50, doesn't mean that you have to sit at home just doing nothing. Keep your body moving, eat good food, eat healthy food, eat lots of fruits and vegetables, and keep your body active.
Okay, so keep moving, keep your body active, and if you have any kind of BPH symptom, go and refer to your urologist because, as doctor said, don't take over the counter medication. Self medicate and worsen your BPH symptoms. So do not do that. Thank you so much, Dr. Shriyansh Chahar, for your valuable time, and it has been a very quite informative session for all our viewers.
Thank you so much.
And we really look forward for many more such sessions in the coming time as well, doctor.
Thank you so much.
Thank you. Thank you so much, Doctor. And thank you so much, viewers, for your excellent participation. For more information and updates, stay connected on our Facebook page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you, and good day to you all.